Hello, my name is Hannah Reederer, and my disability pamphlet is on a devastating and rare disorder called Tay-Sachs. And most specifically, I focus on infantile Tay-Sachs because it is by far the most common of this rare disorder. What you should know about Tay-Sachs is it is a genetic disorder. There is no cure. Um, it is the genetic disorder causes a lack of an enzyme, a hexaenzyme that you need to clear out the fatty proteins that accumulate in your brain. Without it, children start to lose development in all areas at around 3 to 6 months, and life expectancy for those affected by it is often age 5 or less. What I think it's really important for early interventionists to know about this is because we as early interventionists might be facing situations where we're working with kids who have disorders that they may not get better from. But as human beings and people, they still need stimulation, services, and growth, and their families are going to need a lot of support through very difficult times where their children need a lot of care. Um, Tay-Sachs specifically develops around 3 to 6 months, and the infant's vision, hearing, motor, and mental development start to decline at that point. So, the loss of motor control can make it difficult for these young children to swallow, and the risk of asphyxiation from their own saliva can be quite significant. Luckily, our early interventionist speech language pathologists can teach and train these children to keep those swallowing reflexes in place. This prolongs the life and health of these children. Um, the motor skills and development of these children who have Tay-Sachs deteriorates quite rapidly, and by the age of 3, most are considered to have paralysis. They can't move or hold themselves up. At that point, also, their vision or hearing might have declined so significantly that they're considered fully blind or deaf. So, as early interventionists, we might do sensory stimulation that's play based. There are still children who need to feel and experience things. So, as the vision starts to decline, we might use high contrast materials and loud music. And when the vision and hearing is no longer a functional sense, we can use tactile feels and scent to stimulate the child's development. There might be some basic augmented communication systems to help a child express their needs, and physical therapy. So our wonderful PTs will work to sustain the muscle tone that a child has and increase comfort. There is no cure for Tay-Sachs, but there's a lot we can do to increase the standard of living for the child and prolong um, their existence. Now, the cultural implications might come from the fact that as a genetic disorder, it is more prevalent among those of Ashkenazi Jewish descent, Louisiana Cajuns, French Canadians, and some old order Amish communities. Now, if you happen to be working with some in those communities that are more Orthodox, like the Old World Amish or someone of Orthodox Jewish descent, an interventionist might want to be very respectful of modest dress. And that's just a way you don't have to adopt any of the dress of those cultural communities, but to show respect for that. And also ask questions and learn about what is acceptable in their home. Oh, that's the timer, so I'm out of time, but please let me know if you have any questions. I've got a lot of references and resources for family that I've learned about. For example, the Medicaid waiver program can be used to help bypass the waiting periods, and even income caps to help supplement um, the whatever insurance the parents have. Services should be activated as soon as possible, and you can still do a referral through Help Me Grow. There are specific and wonderful support groups for families who are facing significant genetic disease that will eventually take the life of their child. So please let me know if you have any questions, and thank you.